Hello, everyone. I have a quarter after the hour, and I think I will go ahead and get started. We may have a few additional folks jump on, which is absolutely fine. I will point you to the chat if you have questions, but since we are a small group, feel free to just unmute and ask questions as we go. It is not a formal presentation by any means, so please feel free to ask questions as we go. I am Dr. Stacy Sainer. I serve as the program director for the Health Professions Education Graduate Programs. That'll be in the School of Medicine. And just so you are aware, our graduate programs is a joint venture between my office, which is the Health Sciences Center, Office of Professional and Educational Development, and the School of Medicine. So welcome. I'm going to spend about 30 minutes, maybe a little less, going through our program and our expectations and all things HPE. So welcome. The first thing I always like to do is walk through who the core faculty are for our health professions education program. And so there is my name. I do teach several of the courses. We also have Dr. Laura Weingartner. She's an assistant professor in the School of Medicine, and she is the director of Health Professions Education Research. We have Dr. Russ Farmer. He is an associate professor in the Department of Surgery, and he is also the Senior Associate Dean for Undergraduate Medical Education. And then I have Dr. Will Abshir. He is a dental faculty in the University of Louisville School of Dentistry as an assistant professor. And we also have new folks joining starting this summer. I have an infectious disease pediatrician. Oh, sorry, my phone is ringing. Let me go ahead and turn that off. We have a pediatrician in infectious disease by training, and then I also have a PharmD or a pharmacist who will be teaching a course on interprofessional continuing education. So I also like to talk about what are the goals of our program, because all the programs are different. And so I like to point out what the specific goals of our program are. So the first goal is I really think our program is well designed to develop educational leaders in the health professions education field. And so there are tons of practitioners and clinicians that work in HPE, but not as many that have that education background that can help make leadership decisions and the best educational decisions for your learners. The second goal is to be able to provide that academic healthcare institution with highly qualified educators, right? The more highly qualified clinicians and PhD educators that we can get, the better the learning will be for the next generation of providers. And then our final goal is to really serve the discipline of health professions education. If you've never looked, there is a very, very rich area of scholarship and research available in health professions education. And so hopefully by providing, educational leaders and helping the institutions, we will then also be serving the discipline as a whole. I also like to talk about competencies. Competencies, what I want you to be able to do at the end of this program. And so technically we've got 6 competencies. The first one is for you to be able to leave our program and have the ability to create learning opportunities that are truly informed by relevant adult learning principles, learning science, and you can do that if necessary, in a clinical learning environment or the didactic. Some people are strictly clinicians, some people are strictly didactic, but we will give you the opportunity in our program to explore both. The second competency is by the time you leave our program, you will have the ability to assess and evaluate and use research and literature to support your practice. We want you to be able to assess, did learning occur? We want you to be able to do programmatic evaluation. Is the program meeting the stated goals? How do you do that? And so that's what this competency is about. Our third competency is to develop and promote yourself as a professional educator. So many of you have spent years probably developing your clinical identity, whether you're a dentist or a physician or a nurse or whatever discipline you may be. But you know what? If you're going to be teaching, we want you to develop that educator identity. And I want you to come and figure out, how do I merge my clinician identity with my educator identity, and just take that to the next level. Our fourth competency is to really embrace and prioritize inclusive teaching practices. I want all my graduates to have the ability to create inclusive and safe learning environments. I want them to be able to think about equity and what is equitable in learning, and be able to identify the areas that are necessary for change to have that work. Our fifth competency is to help you develop some scholarly skills. Like I said, HPE is a rich area, a rich discipline for scholarship. And so one of our competencies is to help you understand and have the ability to do health professions education scholarship. And so whether that is in the clinical realm or in a didactic or classroom setting, small group setting, we want to give you those skills so that you can add to the discipline, support the discipline of health professions. And then our last competency is what I really want all our graduates to be able to effectively lead and influence the environment that they're in. So if you are an assistant professor, but you are working on your skills as an educator, I want you to be able to work across not only departmental components, but cultural components, functional components of your institution, so that you can truly keep in mind what is best for the learner and help other faculty and leaders in your institution see that as well. So those are our 6 competencies. And these would apply to our Masters of Science in Health Professions Education. And so the next thing I always kind of talk about is what's so special about our program. And one of the things that I like to point out is we've got clinicians with education degrees on faculty here. A lot of HPE programs may have some clinicians that teach, but they may not have some education background. Maybe they've just been teaching for a long time, which is fine. But I've worked really hard to get clinicians with education degrees to be part of our program. The other thing I'd like to point out is that almost all but one, all our courses are 8-week asynchronous courses, which means they're 8 weeks long. That is the length of a course. Most people look at it like, all right, I can do anything for 8 weeks. And they're asynchronous, so it's on your own time. You do it in the week, from week to week when you have the ability to do it. And so it's really, it's not that difficult to keep up with the work because of the asynchronous nature of our program. The other thing I'd like to point out is here in our HPE department, my goodness, I'm getting all kinds of phone calls today. So I should have muted my phone. We really care about our next generation of providers and supporting your journey to become a better educator, and the journey of our people that we are training. And what I mean by that is myself and the team, we look at every assignment. We look at every reading. We look at every assessment. And we make sure that A, it's of highest quality, and B, that it's not doing something for the sake of just doing something, that there's an actual reason for you to do that activity, that project, whatever it happens to be. Because we also know you guys are very busy professionals in your in your life, and you don't want to be doing things that are not going to give you the biggest bang for your buck. And so we work really hard to make sure everything we ask of you is really important and is going to make an impact on your learning, because otherwise you guys are taking care of patients and we're not going to have you do something just for the sake of doing something. And I also like to point out that our program, the real concentration is on the teaching. There are lots of HPE programs out there that work on scholarship. How do I become a researcher in HPE? Which is great. And I'm thrilled that those are out there, but that is not our concentration. My goal is to have everyone that goes through our program to be an amazing educator, someone who is always thinking and looking through the lens, what is best for my learners and what can I do to help my learners be successful? And so that is the frame that we use in this program. So let me break down the program so you can learn a little bit more about it. We do have two different programs, two different graduate programs. We have a HPE graduate certificate, which is 4 courses, and it is 3 credit hours each for those 4 courses, or 12 total hours. This can be completed in 1 calendar year. And the 4 courses that make up the certificate course are HPE 650, which is evaluation and assessment. So how do you evaluate programs and programmatic change? How do you assess did learning really occur? These are really important topics to be able to cover. HPE 665 is teaching and learning. This one, we're going to spend some time talking about research. We're going to talk about best practices and evidence-based teaching. We're going to talk about learning theory, and we're going to talk about learning science. How does learning really work? And what are those things that we've been doing for years and years that really have no impact on our learning? And one of those things you can tell your trainees and your students to help them spend their time wisely when studying. 675 is program development. So as it states, program development, this is how you develop a program. Anything from a new course to a residency or fellowship program. What are the steps and things that I need to do to either revamp a program or completely come up with a new one from scratch? So this course will help you do just that. And then we have 676, which is instructional strategies. This class, I like to dub it 1,001 ways to teach something. And so a lot of it comes down to the content you're teaching. Is it an asynchronous situation? Is it a live situation? Is it a face-to-face situation? Is it a clinical situation? Is it small groups? So it comes down to those two combinations. What is it? And how's it coming across? And then you can pick from multiple different strategies to help make the biggest impact on your learners. So that's what that class will do. So these 4 classes together will give you the graduate certificate in health professions education. Now, if you wanted to continue on, you can move towards the master's degree. And so for our Master of Science in Health Professions Education, it's 11 courses. Most people are like, well, how long does it take? And so most people take 2 courses per semester. And so generally people can get through this program in 2 years, sometimes 2 years in a semester, depending on how things roll. So the master's degree is a 33 credit hour non-thesis degree. You don't do a thesis in this program. You actually will be doing a 16-week professional project. So before I stated almost all our courses are 8 weeks long. Your professional project, either the very last course you take or the next to last course that you take, is going to be a 16-week project. And the goal here is to do a complete curriculum revamp or create a new program. You will, or the other option is a mini HPE research project, and then you will have to write up an executive summary and do a professional presentation. And so that is really what you do to round out the master's degree. So what's going on in between there? We've got I like to point out that all our courses, now that we're in the School of Medicine, are all HPE specific. There are the 4 certificate courses that I just talked about, which were evaluation and assessment, teaching and learning, program development, and instructional strategies. So you have those 4 courses. So there's 12 hours. And then you add on the following. You have educational leadership. I talked about one of the key competencies is to help you lead in an academic environment. You will also take evidence-based practice in health professions education. This is really the only course that will help you with scholarship in health professions education in this realm. And then we have diversity in higher ed, and this particular class is diversity in higher education in the health profession. So it is specific towards our environment that we work in. We'll talk about social determinants of health. We will talk about the different topics that are relevant in the health professions as far as diversity and equity and inclusion are concerned. And then obviously you've got your professional project. There is a lot of it. And then you've got to come up with 3 electives. And so here are just some examples of our HPE electives. We have HPE 650, which is a feedback course, 680, which is interprofessional education, which is the one our PharmD will be teaching, our pharmacist. And we also will have 654 or well-being and health professions education. And so it's really important to not only take care of yourself, but thinking about your learners. And we know what type of stress and crazy environment, especially, if we're talking about medical residents and fellows that are in there, and thinking about well-being is also critical to making an impact on our learners and their learning. Also, I like to point out that our program has been mapped to the competencies of the joint accreditation programming. So we are looking at how this professional master's degree can become more interprofessional in nature, because as well as I do, healthcare is a team sport. It's not just an individual provider doing all the work. You need lots of help. And so we are working closely with our interprofessional continuing education programs to help that and get exactly where we need to be. So I wanted to bring that up as well. So if you need help, if you need support, we have totally out of order, but I'll put them all up there simultaneously. We have Cassie Thompson. Cassie is our enrollment counselor, and she can help you on the front end around, how do I apply? How do I get, what do I need? All of those good things. And I can go through that as well. We also have Jamise Harris, who has just popped up. She is our admissions specialist specifically for health professions education. She works directly with me and the other faculty in health professions education, and she is here to help you once you get into the program and make sure you are taking the right classes and doing all the things that you need to be able to graduate on time. And of course, myself, Stacy Sainer, I am here as well. So here's a lot of great information that you can reach out. So questions that I hear a lot that I'll address quickly. When can I apply? When does it start? All of those good things. We do have 5 start times a year because since we do 2 courses per semester, you can what we call fall 1, fall 2, and then spring 1, spring 2, and then summer. And so there are 5 different opportunities for you to begin the program over the course of a calendar year, which is very helpful. It is too late to start in spring because spring 2 is going to be here in just a couple of weeks, and I don't think I could get you admitted in a short period of time. But if you are interested in starting in the summer, I highly recommend starting to work on that application now. I would say the deadline to get applications in for a summer start would be around the end of March. Sometimes we can finagle some things, but it does take several weeks for the admissions office to get all the paperwork in order. And Jamise is here to help with all of that. And Jamise will work directly with the graduate school office and help make sure everything will get to where it needs to be. Let's see. I did see a question in the chat about scholarships. At this time, I don't have scholarships available. That would be something that you could pursue on your own. We do not have scholarships here at U of L. Any scholarships we do have, we generally give to current fellows and residents in our medical school. And so we don't provide scholarships outside of the medical school currently. But I know there are different organizations and programs, and maybe your your employer or somebody has a way to help with that. Yes, it is completely asynchronous. So, because asynchronous online, so there are no face-to-face like physical component for you to come to Louisville. Everything is online, so you can take it from wherever you happen to be. There are optional times where you would meet as a class with faculty. And then in certain classes, you would set up times where you might do a presentation or something of that nature with individual faculty over the course of the semester's work. So, but there's not any mandatory class time like on Zoom or Teams or anything like that. Ah, I always forget that part. Let's see. I think the tuition is uh, $697 per, or is it 797? Wow, you would think I would know this. I apologize. I'm sure Jamise is looking it up for us right this minute. I believe it is maybe close to $800 per credit hour. So I think it is 792 or 7 something per credit hour. So there's 33 credit hours. So you would take that individual credit hour cost times 33, and that would be the cost of the entire master's program. There are no additional fees through our online learning program. You just pay the tuition. And then for the certificate program, the credit hours is 12. So 12 credit hours times the cost per credit hour, which I believe is around 792, 793 per credit hour. But in addition, there is an application fee when you apply. The graduate school will charge a fee of, I think, $65. You will be required to submit all transcripts from any institution that you have attended. Most specifically, they will be looking for your highest degree attained. So if you have an MD or a DMD or a PhD, they specifically will want to make sure they get that one on file as soon as possible. In order to apply, you will have to have a statement of purpose, which is basically just telling, what the program is and why you are interested in it. And then finally, you need a single letter of recommendation. And let's see. Oh, I do see your question around fees. I am not aware of anything. I know the only price difference that our university has is for active military. So there you go. Thank you, Jamise. $7.91. I knew I was close. All right. Well, I am happy to answer other questions. All right. Sorry. Yeah, we do not have scholarships for this program. Are there any other questions I can answer at this time? Well, I can't really make that out. Um, if people don't have specific questions, you are welcome to email me or email Jamise, um, and we're happy to answer any questions that you may have. And I can stay on the line, um, and see what I can. I know, it's a great program. I understand. I have no way that I can do anything around what the university charges. It's not within my control. Well, with that, feel free to email us if you have other questions or need additional information. You can email any of us, and we would be able to help you in that. Yeah, I know that requires funding, so I have to get more students before I can work on scholarships. So thank you so much. That is my goal. I do plan on it. Prospects for the masters in the US, um, as in what do individuals in the US do with this degree? Is that what you're asking? Ah, so most of the folks that are take this master's degree are already clinicians of some sort, whether they're in MDs in medicine or dentistry, nursing, or any other type of allied healthcare, whether it's ultrasound or dental hygiene or anything like that. And so, especially in the United States, if you want to be like a faculty, let's say at a medical school, you know, this degree is designed to help those individuals learn how to be an educator so that they could educate their students and trainees. Or if it's an allied health profession, such as dental hygiene or ultrasound or something like that, those individuals need at least a master's degree before they can teach at an institution of higher ed. And so people that come into our program that are in allied health do so because their goal is to teach in higher ed. Um, at some point in their career. But we do get a lot of MDs and dentists that work in this program because they want to learn how to be a better educator, and then they want to learn, take advantage of different knowledge and skills for their profession. Maybe they want to be an education dean, they want to be a program director or a clerkship director. And so these degrees are becoming more and more required, especially in the United States, for folks that want to take leadership roles in higher ed. Sure. Well, we're happy to answer any other questions, and feel free to shoot us an email, and we'll be happy to get back to you. You guys have a great rest of your week.